Hi, what I want to talk to you about today is staying sexy with bioidentical hormones. For me, bioidentical hormones have been a godsend. When I was in my late 40s and early 50s, I just felt like life had become kind of like Kansas. No offense to Kansas, but I mean Kansas in Wizard of Oz. It was kind of dull, lifeless. I couldn't gain my sense of positivity about the future. I didn't feel attractive. I felt very little sex drive. And when I went on bioidentical hormones, boom, it was like Dorothy entering Wizard of Oz. Everything became in color. I had energy again. I felt sexy again. And I just think they're a godsend. And I think that's something that anyone who is later in life should consider. And I'm here today to introduce Dr. Gail Jackson, who's an expert on the subject, and she will answer your questions. Dr. Jackson is someone I really respect and worked with for quite some time. So here is Dr. Jackson.
But I always like to start a slide off with who I am, because you don't know who I am. And I think most importantly is I'm board certified in obstetrics and gynecology and on staff at Cedars-Sinai. And what I'm about to share with you is not in any of that curriculum. So I have access to all the greatest curriculum in the world. And there's not one thing in any of that curriculum about bioidentical hormones. So when you go to your practitioner and ask about bioidentical hormones and you are surprised that they don't know anything about it, well, it's not in Western medicine. It's in integrative medicine. So that just has to be your choice. And just as though different gynecologists have their little specialties and their things that they want to really focus on, that's just what I chose to focus on. Reason is, about probably maybe 15 years ago, one of my girlfriends came to me, Sandra. Well, she called me one night, Sandra, and she said, I'm walking out of my house and I'm walking into my swimming pool. Problem, it was 10 o'clock at night in October, because she was so done up and so frustrated because there was nothing I could do or nothing I could offer her to help her with her hot flashes. So I had other patients like Sandra. I had a patient, Janet. Janet and her husband were married 20 years. I delivered their kids. And she said, I love my husband, I love my family, but I just lost that loving feeling. I just don't have that desire to have sex with him or be with him, and I want that desire. I had nothing to offer in traditional medicine. So I knew at that time there had to be something out there. So I made it my charge and my challenge and my goal to find out what was out there that was safe, convenient, and effective for women over 45, so it's a couple of you that are not quite with me, but you'll be there, about women over 45 to just live fuller. So what is menopause? Menopause basically is no more periods for the rest of your lives. And it's not one day that a woman tells me, oh, I've been through that. So we're focused on keeping you fabulous through each of those days beyond when your periods begin to skip or stop. And some of the symptoms of menopause, or some of the symptoms of perimenopause, or symptoms of hormone deprivation or deficiency start in actually the early 40s. And they are those little nagging ones that just send you to me. Well, first of all, the main symptom that sends women crashing through my doors is the hot flashes. I can't sleep. I'm on the stage. I'm like, Catherine, I'm on the stage, I'm presenting, and oh my God, I'm just dripping, wet. What am I going to do? You got to do something, because I've got to be present, I've got to be effective, and I can't control this. You've got to help me. So this happens when women get probably close to 50. And so it's hot, and other symptoms of low estrogen are hot flashes, night sweats, dry skin, dry vagina, saggy skin too. The little nagging symptoms that you felt like you couldn't do one thing about are symptoms of low testosterone. And yes, women do have testosterone, okay, about 1/10 of what men have. Because many women say, well, I didn't know women had testosterone. Symptoms of low testosterone in women are irritability, mood swings, low libido, weight gain, difficulty sleeping, memory, focus. And I think the most common symptom I hear is women that come in and say, I'm working out, I'm eating the same, Why am I looking like the Pillsbury Doughboy? What happened to my curves? Why are my muscles mushy? Well, you're not going to lose weight, you're not going to tone until your testosterone's balanced, because it increases your lean muscle mass. Testosterone really will change your life. And symptoms of low testosterone began in the early 40s. So often I have someone maybe trying to run a marathon or trying to train and like, okay, I have no energy. When I work out, I see no results. And they may be just 43, 44. And we get their testosterone, do their testosterone level. First of all, they've gone to their primary care and they run a thyroid test. And they're like, your thyroid's fine, you're good. Well, then they'll come to us and we're like, well, your thyroid can be balanced. We can augment and kind of propel your thyroid a little more, because we don't wait until your levels are out of balance before we treat a disease. We balance your endocrine organs to help them produce effectively and at every time before they become deficient and non-effective. So then we draw your testosterone level. We balance testosterone between 150 and 200. And even if the lab slip tells you normal is under 40, your body can handle so much more, and you will love how you feel when your body handles so much more, when you give so much more. So when I first, before I became aware of bioidentical hormone, what's out there? Synthetics. Those are the ones you read in the papers all about, and why? Because only pharmaceutical companies are going to put money in products that they can make money off of. Bioidentical hormones cannot be patented. So that's why you're not seeing huge studies about any bioidentical hormones or supplements, because they can't be patented. So all the symptoms that you're aware of associated with synthetic hormones, they simply decrease your symptoms. They do not supplement your body with what it's low in. And it's one size fits all. You go to your doctor, you're having hot flashes, they give you 0.625 estrogen, every woman. And I look around the room, there's not one woman in here who looks the same. So how in the world can your needs for hormones be the same? And of course, the catastrophic side effects. And I wanted something for myself that would be safe, convenient, and effective, but more importantly, safe. So then I became aware of bioidentical hormones, researching integrative medicine, and more aware of them in the form of creams and pills and lozenges, etc. But we like bioidentical hormones, number one, because they're made from yam. Okay, Mother Earth, how can you get healthier? And it's individually dosed for your needs. So for instance, if you come in, I can look around the room. If you came in, you probably wanted a lot of, you probably would need maybe more testosterone, less estrogen. And then as we get a little closer, a woman may want more estrogen and a different level of testosterone. So again, it's not a one size fits all. In my office, I have estrogen in like 5 different dosages and testosterone in 5 different dosages. So there are no side effects associated with the bioidentical hormones. They don't protect you from breast cancer, but they don't increase your incidence. So if you've got strong family history, smoking for 20 years, it can't negate those things. So initially I became aware of the pills, the creams, and the patches. Man, how cumbersome. I think Suzanne Summers is a proponent, but God, what else does she have to do all day other than dose 4 times a day? Okay, I have more things to do. Catherine's got more things to do. So, and you end up in the pharmacy once a month with a bag full of bulky stuff. And the joke I like to tell you, if anyone's single and you're trying to run around with somebody kind of young, and you're trying to go on a little plane, the last thing you want to do is open up a bag at security with all these bottles, all this stuff that somebody takes out, like, what's all this? You're like, okay, it's over. I'm old, okay? So we became aware, and our practice focuses bioidentical hormones in the form of pellets. And why? First of all, they're like a little kernel of cooked rice. We apply them painlessly underneath your skin, okay, after numbing it, of course. And you come to the office every 4 months. And then I just see you at events between that, because there's no need to, or parties. But more importantly, I like it because it bypasses the stomach and the liver. When you take things by mouth, they have to be coated so the stomach acids don't destroy them. Then they go to the liver, so you have to get more before they finally get to where they need to go. And like, I'm finally here. Bioidentical hormones, you put them here, they go directly to the target organs. I always think less is better. Okay? And predictable, dependable results. And as I said, you come twice a year. It's far less costly, and then you've got no product to pack around when you're trying to go through security at the airport and be cute. Okay? Not a day passes that a woman tells me, I'm through that menopause thing, I'm through with that. Well, there are long-term benefits for balancing your hormones. Okay, let's go from head to toe. Most importantly, prevention of Alzheimer's and dementia. Bioidentical hormone balancing is protective of the heart, keeps your bones nice and long and strong. My 2 girlfriends and our 2 daughters were best friends all their lives. Well, we used to all be the same height. I'm the only one still 5'5", because one of them says, she's a physician. She said, I've never had a hot flash in my life, as she shrinks, and the other one just decides not to do it. But it also maintains healthy digestive organs and maintains your bladder and your vaginal health. Let's not forget the guys, okay? You're going to be hot and all in the bedroom, and who do you want to come home to? Okay? Guy on the left, guy on the right. So the difference between grumpy frumpy and a happy hottie is testosterone balancing. Let me give you a story. I had a blind date with this uber successful trial lawyer, and we had breakfast. I won't say that. Well, we had lunch later, and okay, well, I'm balanced. Hey, what can I say? Anyhow, we had lunch later, and so I told him about the benefits of testosterone, and he says, you know what? I really could stay up late. I could really be more on it, more focused. Now it seems like I can't stay focused. I can't stay awake and whatever. So I balanced that guy, and by golly, he married me. You know, where's the guy gonna go? So as guys get lower, their testosterone lowers may affect their sex drives, and then they can get erectile dysfunction. But more importantly, loss of energy, the flabby muscles. So we balance a lot of partners. So the guys typically come in the same thing. I've been working out. Look at me. You know, I'm lifting it, but look at me. And we find that their testosterone may be half a tank. They may still be having adequate and strong erections, but and they feel so relieved, because if you have any symptoms and someone tells you whatever they can evaluate, this is all they know, and you're like, well, help me, and they don't have anything to offer you. When you find out what the solution is and you see the results, you feel relieved, because it's not in your head. You're not crazy. So again, why bioidentical hormones made from yam? And they've been around since the 20s. Okay, so they're nothing new. They've been in Europe since the 20s. Pellets they've been using pellets since the 40s in Europe. It's just new. It's relatively new. And the thing is, it's just a gynecologist has to just be interested in offering it, because they're around, and you just have to be interested in doing it. Okay, and made from yams, less dose required for maximum results, and again, customized, since it's no one size fits all, and cost effective. Well, let me tell you how it happens. First of all, you come in the office because you're interested, curious. I ask you to have your blood work drawn before, and you can just get it off our website, the list for your blood work. And then, most importantly, it's an individual consultation, and I ask we have a questionnaire, and you go through your symptoms, for instance, and you check your yeses and nos. Then you quantify your yeses and nos. Then you tell me what your goals are. Like, your goal may be, look, I want to lose this weight. I'm trying everything. I can't lose this weight. Or I want to get in this bikini, and I can't get back into this bikini. And yes, I do wear a bikini. Anyhow, so I'll look at your blood work and listen to your goals. Okay, and then, but more importantly, between the two are your goals. For instance, if your estrogen level is 50, or let's say after we balance your estrogen level is 40 or 50, and you don't have hot flashes, I'm not going to give you full dose and make you 80 just because I want to respect the breast. Okay, we give you the dose that works for you and works for your history. Women of color have more fibroid tumors, so I tend to maybe start them on a little dose, check the blood work in a month, and I can always give more. Since I can't take it out, I'd rather err in giving you less and let you come back in a month and check it. So initial consultation requires just going through the questionnaire and just talking about what your goals are, looking at your blood work, and just getting an understanding of how the hormones can help you. Does that answer it? Right? Mm-hmm. And so then we decide what the dose is for you. I administer the pellets in the room, And then we draw your blood in a month to see where we got your levels to. And they last 4 to 6 months. So in 4 months, or if you feel like, oh my God, I'm not feeling good, you can get your blood drawn. We come back in and we give you, reboost you, give you another set of pellets, fresh pellets each time. So we get you right where you need to be, and then and most of the time the answer is, I feel fabulous though. And I think one of my patients asked, well, what does testosterone feel like? And she just described it, and I think she described it succinctly. She said, before I was balanced, I felt as though my world was in black and white, and now it's in vivid technicolor. And I can tell the difference in a room of a woman who's balanced and who's not balanced. It's just very clear. Because a woman who's balanced always wears red lipstick because she just, and whether or not you're having sex, you should feel like you want to have sex. Or you should look like you want to have sex. Because men love women who love sex. Yes. We have, I think our oldest patient is 76. And our youngest is, I have a woman who had a hysterectomy because of endometriosis. So I think she's 40. So she has no uterus. So both of them. So the trend is, if a woman did not have a hysterectomy, let's say at 45, most of her symptoms are related to low testosterone. So she's probably getting testosterone only. As we get toward 50, she probably comes in the office and like, why am I so hot? Or we're drawing her blood and we're seeing her estrogen drop most commonly, and then we begin to add estrogen so she doesn't go through that abruptness. So toward 50, many of us can recall how bad 50, 51, 52 was. Then it kind of settles down. Right. So as we get towards 60, then we give you enough estrogen to keep your skin nice and soft, and so it won't be creepy. And then we bring your testosterone down. Then women just continue to get it, and because there are long-term benefits. And they do, the skin is just dramatically different with just a touch of estrogen or without.
I'm not having huge, but if it's a benefit, then why not?
But you're not wearing red lipstick either, and you didn't come dressed like I came. Okay, so I think you'd like a little testosterone. Okay.
So I'd be up for the testosterone.
I'm sorry.
So I'd be going for the testosterone.
Right, and we give you a little estrogen because your skin doesn't look like mine, and we may be the same age. That's all I'm saying.